Good afternoon, everyone. I'm from Prime Therapeutics. We are your pharmacy benefit manager. And if all of you are new or not used to that, we manage the RX solutions, your prescription drugs. So I know that's a very important piece, and I invite all of you that have questions or concerns or have had issues with any of this that you come speak with us and the team that we can help discuss this or provide you more information than I may be giving you here. Just to give you a quick rundown of what we're going to be talking about here, give you a quick brief organizational overview, a little bit about your 2026 details, and then some of the support and programs we have to offer. So I would invite all of you, if you have questions about any of the slides, please feel free to raise your hand and let's get them answered, because we want to make sure this is informative for you and your members. And part of the things about what we do for Prime here, right, and everybody is geared toward the same thing, and that's to provide the best kind of care that we can. And Prime is trying to reimagining that ourselves to be more member-focused, to provide that great care, and we do so that we provide the same care that we want for ourselves and for our loved ones. And so our dedication is towards you, your members, and providing that great service. And how do we do it? It's to be a few of these things. One is to be transparent and conflict-free. We don't own our pharmacies. We invite all of those pharmacies into the network. We are 66,000 plus pharmacies strong. We open up the pharmacy network to all of your members and to all of those people without having to force them to particular pharmacies that we own or our support businesses or verticals may own. That's not part of our business model. So you're free to do wherever you want to as far as filling your medication. The cross-benefit management, that specialty experience, right? So we want to be able to maintain a detail around both medical and specialty, and so we offer both. We offer an integrated medicine that allows that to be able to review and to take a holistic approach around how we manage care across medical and pharmacy benefits. The third is, technology, right? We're trying to utilize as many new programs as we can, new technology in our systems to provide great care and to lower operational costs, because in the end, we want to reduce costs wherever we can, both in our formularies and our drug programs and our networks and all of our business units, because as David said, costs are continuing to increase, and everything that we can do to drive those costs down is what we feel responsible for doing. And that leads right into the most important piece, is this purpose beyond profits. Prime is not a public company. We're owned by 17 different groups, so they all have a vested interest in making sure that we're operationally efficient, that we're low cost, that we're offering the best part of service. And so we're not held to what the market requires. We aren't required to meet quarterly business goals in terms of what the market is asking for. So we're trying to give us the lowest cost available to all of our programs and to the members throughout the year. All right, so for 2026, what does this look like? Overall, the plan design remains the same. Nothing is changing in terms of your drug copays. There is a slight change in the increase of the out-of-pockets overall, and that's to stay in line with the state Medicare range. So that will increase to $10,600 and the family to $21,200. Again, that's required by the state, and you stay in line with that. But overall, your formulary changes will not change. We're still with the Net Results A formulary, which I'll talk about here in a little bit. But those are small changes that we make basically for 2026 as drugs come on board, as they are taken off. So we have new drugs that come available, biosimilars that come available, generics, obviously, as they come available. We want to add those drugs to reduce costs and provide availability across the formulary. Retail network changes. Everything is staying the same in terms of our overall network. As I mentioned, there's 66,000 plus, about 1,400 in the state of Alabama. We continue to add those, both independent and retail. So we expect that to continue to grow, and we offer what's called any willing provider is required by the state, that any pharmacy that would like to join our network is able to do so. So if you have friends, family, or loved one who are not part of the state, if you have specific pharmacies that you'd like to see be able to fill that and they are not part of our network, you may invite them to reach out to us. We will help them join our network, and you can fill there. Prior authorizations, nothing's changing in terms of the prior authorizations for this year. If there's one already in place, it will carry over. Each one has their effective date that you may be well aware of. We're going to continue with that process as well. And member inquiries. We still have our joint group with Blue Cross Blue Shield, so your members are continue able to call in through Blue Cross and be able to answer their questions for both their medical and their pharmacy through the single contact center. So let's talk a little bit about member support. So overall, again, as I mentioned, you're going to continue to use that primary support center. They're available from the 7 a.m. to 6 p.m. and then it will automatically roll over to the Prime-centric call center that handles after hours as well as holidays and weekends, etc. So use that, continue to use that. And I would also have you urge your members to use this. This is staffed 24/7. And so if you're trying to get a hold of the plan or folks that you know within the plan, this is actually a much faster route. We're able to turn around things a little bit faster than we are if we're going through that route as well. So I would invite you to use this first and to be aware of what they can do. And they can certainly help your members and help yourselves a little bit faster than you may have seen otherwise. ID cards, these are not changing for next year. So the same ones you have would be the same ones that you'll use for both medical and for your RX. So if you are switching new to the plan or new members, make sure that they put those in the pharmacies because you could have rejections at point of sale if the members have not used their new cards and they're bringing that in, especially if they switch groups or have new cards, and especially that they bring those to the pharmacy again. Same number for your medical as you would for your RX. And our formularies I talked about, and that's net results here. So this is our widest type of formulary that we use. It has less restrictions. It provides the most generic equivalents and alternative therapies, again, to reduce costs and provide effective management of generic and brand drug prices. So this is something that I want you to be aware of in terms of how to utilize this, how to find the drugs, how to price drugs, etc. So I want to talk about that next in terms of how do members need to be familiar with where their drugs are, how to price them, and what they do is, right, I'm going to invite you to go to myprime.com. And now what that allows your members to do is basically find out everything they need to know about their RX specialty or RX and specialty drug programs. In this case, you can search for your medicines, you can compare drug pricing, find a pharmacy, you can find the different prices of pharmacies between different drugs and different pharmacies. You can track your prior authorizations. Again, we'll chat about that here in a minute, but you can also view claims history, and more importantly, you can submit for reimbursement on those DMRs or direct member reimbursements. It's important to be able to find that information and quickly turn it around. You can do that from a single source, which is MyPrime. So on the MyPrime, a couple of things I want to call out for you as a way to find medications. And I saw a few of you who were talking about not being able to find your drug, new members that may be coming on board and needing to understand how they're going to price their drug and where they can fill it. So MyPrime is really the place to go. If you're assisting your members and they haven't signed up for the plan but would like to understand what's available, even without signing in or creating a profile, you can use MyPrime to identify the drugs, identify generic alternatives or alternative drugs in case those are not on the actual formulary. So use that to guide your members, your new members who may be coming on board. If they do come on board, then creating a profile is certainly the best way to do that. Again, all of those options are available for you. Once you've done that, again, in this case, you can go to the medicines indication, search for your drugs. You can search, I would mention here the net results A is the important formulary you need to be choosing. And then that would be allowing you to choose whichever drugs you have and be able to price and identify where they are in your network and which is the cheapest pharmacy for you. All right, DMR, these are important, right? Because your tier 2 and tier 3 drugs require these. So if you are on these medications and you're submitting them with your request, you can do that now through MyPrime. There's a brand new area there that allows you to submit for your tier 2 and tier 3 drugs, as well as others that are paper claims for direct reimbursement. So all those forms are located on MyPrime. They're also on the LGHIB website, and it'll give you some directions on how to submit that and what you need to submit with it, specifically your receipt. So I would recommend that you remember to notify your members that both the pharmacy and the cash receipts are necessary. We don't want to slow down the process at all, so having them submitting everything right up front is the best option for a quick reimbursement. And we've also updated our process to support you to turn around our claims once we have completed the DMR process to reimburse the members within 24 hours of that approval. So that's continuing to be as fast as we can because I know that those copays being out of your pocket is pretty expensive, and so we want to turn that around as quickly as possible. And the easiest way to do that is from the LGHIB or the MyPrime. On this MyPrime, basically through the forms and onto the direct member reimbursement. You can see there is the quickest way to create your profile and to develop the DMR form and get that submitted. So if you have those instances, I would advise members to quickly do that and get reimbursed as fast as possible. The same thing for prior authorizations. If those of you who are familiar with prior authorizations, they can be a bit of a harrowing experience, right? It's important to have these for the medications and the experiences that the member needs, but there's a lot of coordination that takes place between your doctors, between the doctor staff, between ourselves, Prime, and some of the other areas in between, because there's a lot of data that's being needed, and it's supposed to be very, very specific, and that is not always given the right care. And so for members to be informed about where things are at, the MyPrime app is a really good place for them to be able to track, see where the results are, be able to have coordination with both the provider, ourselves, the data that's submitted back to them, and their dispensing pharmacy. So again, this is a way for you to track, be able to identify where those things are at, and move forward as quickly as possible. I want to call out one thing as far as the MyPrime. I've noticed in other situations that you'd be looking at your MyPrime app or you're looking at your profiles, and if you don't see all of your members or all of your dependents in your profile, that's because you have to be, if you're 18 or older, you will have your own profile. So if you're a mother and you only see 2 dependents or you don't see your husband, that's because all adults 18 and older are required to have their own profile for PHI reasons. So if you do see that, that is the reason why. So looking at some of our programs here, and I want to spell this out because all I've heard today was a lot of good information about the programming that everyone here is giving you, and there's a lot of good coordination about that. LGHIB has done a fantastic job of putting together a significant amount of programming that's all basically free for your members for this point. It's all baked into the services that we provide. And so I would definitely recommend that you take advantage of all of them. I think they're fantastic. They're all built to both save money, reduce time, and to aid the member in all of their endeavors. So we're no different. We want to offer as many programs as we can to do that. And one of the ways we do that is with a couple of programs around specialty drugs. And if you're familiar with specialty drugs, they're very expensive, and they're concentrated on incredibly difficult case management, care management, disease management instances. And so having access to these and understanding the way that they have to be managed is certainly important. One of the ways is to reduce the overall dollars and copays that are coming out of your members' pockets, and Flex Access does that. So it utilizes the manufacturer's copay assistance to reduce that dollars overall. It's not taking away from your members, it's actually reducing their cost, it's reducing costs for the plan. So in the overall, you all are saving money. This is all important. It does take some coordination with the Flex Access groups, and so they will advise your members to sign up if there isn't. And if you've seen some instances in the beginning of the year where members are suddenly exploding because their costs are significantly higher, well, in the case of that, it's probably because the programs are not realigned, meaning that the member needs to re-sign up for Flex Access and those copay programs. They usually roll over once a year and they make you re-sign up. So that can be a concern right at the beginning of the year if your members are not familiar with it. So be aware of that. This is certainly a program that our teams will try to guide you through as best as possible and to associate with you with the necessary formulary and pharmacy. For that instance, the specialty pharmacy we use is a Credo. And I know that that's somewhat of a difficult conversation. I know a lot of people have been upset with the Credo, and some of you have had good experiences and bad experiences. So I would invite any of you that you have some concerns or complaints or good suggestions to us, please come talk to us. We're here to make sure that those are addressed, and we work with those teams to manage and make things better for you. So again, but a specialty pharmacy solution for this year is going to continue to be a Credo. We also offer the state wellness pharmacy is available to you. So you can use one of those 2 pharmacies for your specialty drugs. And again, it's not just the specialty dispensing, right? It's more than dispensing. It's your care coordination and delivery of medications. These drugs may need to be refrigerated. They may need to be delivered within X amount of days. They can't sit on your porch. And again, they're very expensive. So we want to take good care in making sure that those drugs are delivered to you, and they're done so that they have coordination with disease management and they don't have any conflicting instances of care. And I would also, again, offer you a suggestion to specialty signups for Accredo, right? This is another opportunity for you to manage those deliverables, see where your drugs are at, change the delivery schedule, and to help coordinate with those caregivers that are there. So there's pharmacists and doctors on our ends that are all there within the Accredo universe to help you and guide you and understand you, or understand what's happening with the new disease, if so be it. So they will guide those patients through the use of the drugs, how to use them, when to store them, that sort of thing. So it's not just a delivery of pharmacy, it is care management, and I would advise you to sign up so you're aware of that, and they can contact you pretty easy. And lastly, as I mentioned, all of these things that are here, they're here for a reason, right? They're here to save money, they're here to assist, and they're here to make it a little bit easier for your members. So we have a product suite currently in place, and this is pretty much behind the scenes. Your members won't see much of this with the side of maybe Accredo or Flex Access, which is that copay assistance program. But there are several others that are there to derive lower costs, and you may not see them, but again, these are all things that are being done to help you and to reduce the overall cost and better treatment for your members. I'll mention just a few of them here. The Integrated RX. So this is a program that we employ for those that have very specific conditions that need to have coordination between your doctors and your prescribers. For instance, cystic fibrosis and oncology. You don't want to have to coordinate between your doctor and that particular provider and a pharmacist. They'll work and coordinate together to make sure that the drugs that are being provided are delivered efficiently, and there's no loss of communication between those two agents, because it's important when you're dealing with very serious issues like that. So that's a program that's already out there. We're actually reaching out to those members to say, hey, we can help you coordinate this. That isn't something you need to sign up for. But as administrators, I would make sure you're aware of these in case you have members who are looking for assistance or looking for a place to talk or just understand what these new drugs might be, or understanding these conditions. There's plenty of people out there who are willing to help, and these programs are here for a reason. And the same could be for high touch RX, right? If you have highly chronic diseases that use multiple drugs and different sets, you want to make sure that those drugs are not interacting, right? You want to make sure that you're getting the best possible care you have. And we'll reach out to you and help coordinate with that so you can understand the different drugs and different disease states that they need to be managed on. Because the end goal is to remove the drug, right? We don't want them on drugs forever. We want them to be healthy human beings. And so these programs will assist them in getting through that factor. So those are just some of the things that we have out there right now. Again, as we try to mention that we're going to be building more and more that are based upon different types of care that need to be provided. Again, the market changes, people change, disease change. So we're here to build out new things, and you're going to be hearing more of that in the coming years and months. But for now, that's what we're employing, and I appreciate all your time.